Now, from ABC4 News, coronavirus preparation versus panic.
Thank you so much for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. We begin with the very latest novel coronavirus or COVID-19 numbers. The outbreak has now sickened more than 353,000 people worldwide. Now, all those numbers are staggering. The latest numbers from Johns Hopkins University show more than 100,000 people infected across the world have already recovered from that virus. Here in the United States, at least 42,000 people have been infected with COVID-19, more than 500 deaths. The hardest hit states include New York, Washington, and California. Utah saw its first COVID-19 related death over the weekend as cases today surpassed 250 in our state. Utah State Health Department is asking everyone to take precautions.
We're in this for the long haul. These social distancing measures are going to have to be a way of life for Utahns and for the U.S. for the next several months.
To limit the spread of coronavirus, the CDC recommends the following measures. If you or anyone in your family is sick or showing symptoms, stay home and contact your medical provider. Work from home if possible. Avoid gathering in groups of more than 10 people and maintain 6 feet of space from others whenever possible. Now, as you know, restaurants shut down in Utah, so instead use drive-up or takeout, or even delivery options are available as well. Avoid discretionary travel like shopping trips or social visits. ABC4 News is putting the focus on preparation versus panic during this pandemic. For more on what you need to know about this virus, its spread, and what you should do if you should become sick, I'm joined now by Dr. Mike Bauman. He's the Chief Medical Officer with Mountain Star Healthcare. Mike, so great to have you with us. A lot of people on edge now. First, what do we know about this virus and how it's spread?
Well, first, I want to compliment you on your social distancing. I'm outside. It's a tad bit cold, but appreciate the question. What do we know about this virus? It's very much like in the past MERS and SARS. It's very much to a degree like flu. But the big issue is it's a different virus in the rapidity with which it spreads. So unlike flu, which when you have flu, you might hit 1, 2 people, this hits 3 people. So it can spread very rapidly, which is the main concern we have for the healthcare systems is if we can spread that quickly, we might overwhelm the healthcare systems.
Right.
But all the systems are working very quickly and diligently to prepare for this.
Okay, let's dig into that a little more, and I do like how you brought that up. We are practicing what we preach here, so thank you for that. What do people need to know specifically about transmission?
To know about transmission, number one, this is primarily transmitted through droplets. So if you see me do this right now, it's not because I have COVID, it's because it's cold out here, and if I were to sneeze or cough, droplets come out. Unlike airborne, which is more in the air, so the droplets come out, that's why we should do coughing into our elbow, and also be aware it gets onto surfaces. And it can live on surfaces, we think, for up to 1 to 3 days, so we need to be very careful about cleaning areas where we've been. High-touch areas like doorknobs, tabletops with a lot of activity. Be very careful to keep those clean and at the same time keep your social distancing.
I was watching real-time numbers today, and to be honest with you, it's best not to do that. But what is it that makes this virus so dangerous?
Well, part of it is what I hit just a few minutes ago. It's the rapidity of spread. So it spreads more quickly, so more people can be affected more quickly. Flu happens roughly between September and March. This can happen much more quickly and overwhelm it. Plus, we know in certain age groups, particularly the elderly, and in patients with other healthcare issues like heart failure and diabetes, that they're more prone to having problems. But I don't want the millennials and other young people thinking that they're not immune. They can get this too, and they can end up in the hospital as well.
Yeah, that's something we really saw play out today, and that's the message we're hearing from the state, definitely. Talk about symptoms. What should we be watching for? And if we're feeling those, what should we do after that?
So the most common symptoms that we're worried about is fever, plus cough and respiratory issues, mainly shortness of breath. Those can be, though, a lot of other things, the common cold and the flu, but those are the main symptoms, and that's the tough thing right now is how do you tell flu from COVID? But you need to be careful and keep an eye on those symptoms, and if you have them, stay home, particularly if it's only mild symptoms. If you get worse, then you need to come in and be seen.
Doctor, we've been hearing a lot of people say, I have the virus, I wouldn't even have known it. Why is it that some are asymptomatic and others are showing symptoms, and there seems to be quite a range from mild to severe here? Why is that?
I think it's also part of what I hit just a few minutes ago, the difference between how baseline healthy you are versus how many comorbidities you have. So, for example, the case that was really unfortunate yesterday that we reported was an older person who died in Utah who had other health care issues. So older people are more prone to it, younger people less, but even younger people can get ill. So it's a whole spectrum of how people can be impacted by this.
So as we see the numbers continue to escalate here, how is your organization, Mountain Star Healthcare, and its hospitals preparing and dealing with the growing number of coronavirus patients that you could be administering to?
So we have a very proactive program across not only Mountain Star, but all of our hospitals in what's called Hospital Corporation of America. We're preparing by looking at the number of beds we have, looking at alternative locations where we can have beds within our hospital, repurposing areas like the post-anesthesia care unit where we send patients after surgery. That can turn into an ICU. Taking areas that are perhaps administrative where we can move patients in there as long as we have all the available equipment like oxygen and suction. So we're looking at available space and how we repurpose it to be prepared for more patients coming in if and when, and unfortunately probably when, we get this surge.
Let's talk elective surgeries. We're seeing organizations take action there. What do you guys plan to do, and what does that mean?
So what are elective surgeries? And this has been a hot topic, not just here in Utah, but elsewhere. The first thing to understand is elective surgeries are those surgeries that are already scheduled. In our organization, we've been following the CMS guidelines, and they actually have a tiering of what should or shouldn't be done with surgeries. And we very proactively review in our hospitals, often with our CEO, our chief medical officer, surgeons, to look at that surgical schedule and be sure, is this someone should have it? I want to make a comparison. Someone who's coming in for, quote, an elective scheduled lumpectomy of the breast could have breast cancer versus someone who comes in for breast augmentation. Those are two different things. The breast augmentation should be put off. The lumpectomy, even though it might be in one of those lower tiers, really needs that to be done because it can be life-saving because the individual could have breast cancer.
Got it. That makes sense. We've run out of time, but real quick, I do want to let our viewers know how they can learn more about Mountain Star Healthcare and its hospitals. What's the best way to reach out?
To reach out to us, actually we have multiple hospitals, St. Mark's, Lakeview. That's actually a great question, and I'm going to pass it to our PR folks to make sure we get, what's the best way to get a hold of Mountain Star Health quickly. We have Brigham City, Cache Valley, Ogden Regional, down to Lakeview, to St. Mark's, to Lone Peak, to Timpanogos, to Mountain View Hospital. That's our system.
All right. There's one near you. So much panic out there. It's nice to get answers. Thank you so much, Dr. Bauman, for your time tonight. We definitely appreciate it.
You bet.
Still ahead.
Since COVID has been disrupting everyone's lives, I've actually had sessions with clients where I'm spending full sessions trying to help people get out of their panic.
How mental health professionals are helping their patients cope with the stress of a pandemic, and their advice for everyone.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
Okay, so I'm going to contaminate myself. So, start by wetting your hands, getting the soap, and you want to lather first, palms together. And you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs to kind of a circular motion around your thumbs, other thumb, and then the palms of your hands, you do the fingertips around the palm in a circular motion. Get your fingertips nice and clean. And the other hand, and then my wrists. And that was 7 different steps, and if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy, and those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
You're watching Coronavirus Preparation versus Panic.
Welcome back now to the fast spread of COVID-19 and the fallout from the virus. We're talking empty store shelves, self-isolation, shelter-in-place orders. They can all cause high anxiety and stress. Many Americans are having difficulty coping. ABC4's Rosina Nguyen has more on living with the stress of the coronavirus outbreak.
In the midst of the COVID-19 outbreak, licensed clinical social workers in our area say they are seeing a higher need for mental health services.
They'll come into my office visibly like wide-eyed, freaking out, having suicidal thoughts over this whole COVID situation.
Whether you have pre-existing mental illness symptoms or not, Javed says anyone could experience a strong emotional response during an infectious disease outbreak. The best way to minimize your fear and anxiety is to take a break from the news or social media and keep yourself distracted with other activities.
Because our brain is signaling the rest of our body that we're in danger. Like our body actually thinks it's being attacked. And so what you need to do is you need to get up, you need to move, you know.
Children and teens can also be affected from what they see from the adults around them. Experts say it's crucial to be calm when you're around them and reassure them that they are safe.
Because the child's primarily safety net is their home, is their parents. And so if they're not perceiving any sense of safety from their primary caregivers, then that can totally impact a child's mental health and safety perceptions.
With social distancing recommendations, Javed says she and other therapists will offer free online counseling sessions for patients in need who may not have the option to meet in person. Reporting in the newsroom, Rosina Nguyen, ABC4 News.
For more resources on how to help cope with the mental and emotional toll of living through a pandemic, find this story on our website, ABC4.com. All right, still ahead. We've talked a lot about the proper way to wash your hands to avoid spreading illness, but what about the right way to disinfect surfaces in your home? An environmental health scientist walks us through that process next.
You're watching Coronavirus Preparation versus Panic.
A question a lot of us have is how long can coronavirus survive on surfaces? And how can we clean those surfaces in a way to make sure that we are limiting its spread? Joining us now is Andrea Gamble, environmental health scientist with the Salt Lake County Health Department. Andrea, great to have you on the show. Thanks so much for being here. Let's start with do we have any idea of how long viruses can actually survive on surfaces?
So this is a new virus, but experts think that it can last on a hard surface for a couple of days.
Okay, so that's quite a while that it can be put on the surface and you can come pick it up later. So when we clean, what are the supplies that we're going to need to make the most of that?
So the health department recommends using chlorine bleach. It's the very best thing. And you want to dilute it about 1 teaspoon per gallon of water, and you can just put it in a spray bottle, and then you can actually spray the surface, and the contact time is about 7 seconds to kill the germs.
Okay, so that one's going to work really fast then?
Yes, very fast.
And when we're doing that, you're kind of giving us a demonstration here. Is there a proper method you should use? Or how much are you actually spraying down to clear that amount of surface there?
Just enough to make the surface visibly wet, and then you want to wipe it with a paper towel and then allow the rest of it to air dry.
Okay, and after about 7 seconds, that should take care with that ingredient, get the coronavirus off that surface.
Yes, and people often think, well, if a little bit is good, more is better, but that's not the case, especially on a food preparation surface. If you use more, you could actually cause chemical poisoning.
Okay, very good point there. We were talking during the break, and you said something that really surprised me, because the wipes that you're gathering there now, they're very popular, but they take a lot more time to be able to actually be effective against the coronavirus. I was surprised to hear what you told me there.
So if you read the manufacturer's label, it says you have to keep the surface visibly wet for 4 minutes. So that would take, you would have to wipe the surface with a few wipes. And then if you continue reading on the label, it says that you have to rinse with clear, clean water. There's fragrances and chemicals, so on a food prep surface you would have to wipe it off. Okay. So these are really good for doorknobs in the bathroom, but when you're in the kitchen, you want to make sure that you're using bleach.
Okay, very good. What other ingredients should we be looking for when we're looking for the most effective cleaner?
Bleach. Chlorine bleach is the most effective cleaner.
Okay, what about ammonia? People think that, or vinegar even. Any recommendations on those two?
So the health department recommends bleach, and then in the sanitizing wipes, the sanitizer is quaternary ammonia or quats, and that can be effective as long as it's on the surface for at least 4 minutes.
Mm-hmm. Okay, so talk about the importance of all this. You kind of showed us how to do it properly there, but talk about the importance of getting into the kitchen and really doing a deep clean, or even other surfaces throughout the home as well. How important and crucial can that be?
It is very important to clean and sanitize your surfaces, especially doorknobs, light switches, anything that is a high-touch area.
Okay, and then as far, I mean, obviously we're in the kitchen now, but I would imagine bathrooms. What other areas are we wanting to look at and make sure we're getting them clean there?
So anywhere that people are touching a lot, so in your bathroom, the flusher, just things that we don't think about that everybody is touching. The faucets on your sink, just anywhere people are touching.
Mm-hmm. And this obviously, if you're not taking these precautions, what kind of detrimental impact could it have?
So cleaning surfaces is very important, but the most important thing we can do is social distancing. We want to stay away from someone, especially if they're coughing or they're visibly sick.
Okay, so that's even within the walls of our own home?
Yes.
Okay. All right, very important information, Andrea. We appreciate that. Again, I was quite surprised to hear the information you had on the wipes. Didn't realize you needed to really be at it for that long with those. Very popular product, and thank you so much for your time. We appreciate it. Coming up, pets cannot get the coronavirus, but it does not mean that they're not impacted by the outbreak, especially if their owners are struggling. We talked to Best Friends Animal Society about how you can help.
You're watching Coronavirus Preparation versus Panic.
Welcome back. To deal with the high volume of vehicles at health centers, patients can now be evaluated for coronavirus testing in a drive-up location at University of Utah Health. To use the drive-up service, start by calling the U of U Health Coronavirus Hotline. A patient who is presenting COVID-19 symptoms will either be scheduled for a virtual urgent care appointment or be sent to a drive-up testing site.
They drive up, they get checked in by one of our University of Utah staff, and then they go through each tent location and they check in, they get evaluated by a provider, swabbed, and then we send them on their way.
The University of Utah has drive-up locations at 4 of its locations. Those would be Sugar House, South Jordan Farmington, and Redwood Road. Intermountain Healthcare has launched a way to get screened for COVID-19 online. The symptom tracker is now available to the public to help people assess their risk for coronavirus. The checker walks people through key questions related to their symptoms and risk, and updates as new information comes in about the virus.
It's built based upon CDC and WHO guidelines, and it literally updates daily as those recommendations change.
The new tool is free to use. It's available at intermountainhealthcare.org. We also have a link for you on our website, ABC4.com. According to the CDC, pets cannot get the COVID-19 coronavirus nor spread it, but it doesn't mean that they're not impacted by the crisis. If their owners are struggling in the current economic climate, some pets might not be getting the basics. ABC4 senior health correspondent Saray Chin explains how you can help.
The coronavirus on everyone's minds, and not only our minds, but maybe our pets. We want to bring in Tema Martin from Best Friends Animal Society to talk about a couple of things. One, can animals get it, and can they spread it to humans?
All of the health experts, the Centers for Disease Control, World Health Organization, American Veterinary Medical Association, at this time there is no evidence that pets can either contract or spread the virus. So please don't be suspicious of your pets.
Don't abandon them. In fact, there are so many benefits at this stage in time to keep your pets close.
Exactly. Studies over decades have shown that contact with pets reduces anxiety and reduce stress, make us less depressed. And so this is really an important time to let our pets comfort us and keep them in the family, but also prepare for them. So have 2 weeks to a month's supply of pet food, litter, any medications, just in case, so that we can keep our pets home and safe with us, because a lot of shelters are actually working with reduced or, you know,
like so many businesses right now, we
Yeah.
have limited staff. Have you seen an influx of people wanting to give up their animals at this time?
Locally, we have not yet, but it's a reality that's hitting very hard and very fast. People are losing work hours. Some businesses are closed. People are going to be losing income. So it is a concern. Some people are worried about what if I get sick? What do I do with my pet? So plan for that. And really, we're asking people to help each other out. If you have a friend or a neighbor or a relative who is losing work hours or can't go to work, please offer to help them. If you can get your hand on bags of cat food or dog food, help them out so they can keep their pet at home.
Now more than ever, we need to work as a community, as a team. If someone, your neighbor, is having a tough time, that is when you might step up and say, can I take your pet for a week? Can I bring some dog food for you? What can I do to help out?
Sure, you can help each other out in your own neighborhood, but shelters and rescue groups are also asking for people to adopt and foster at this time, because these pets, you know, they need help, and if shelters are closed or, you know, limiting access, the pets need somewhere to go. So you can find out how you can reach out and help.
All right, Tema Martin from Best Friends Animal Society, and a great resource there, and also the CDC when it comes to animals.
Yes, the CDC is always posting updates, and it's a good place to get information. You can go to bestfriends.org or utah.bestfriends.org to find out about other resources in Utah.
Tema, thank you so much for this important message.
Thanks, Ray.
And thank you so much for joining us for this special edition of ABC4 News. We will see you at 10.